What's up, guys? I'm Brett from Limitless Performance Physical Therapy. I want to talk about hip pain today. So you can get pain in the front of the hip, side of the hip, back of the hip. We're going to mostly talk about the side and the back of the hip today. Typically, when we get closer to the front of the hip, it's more considered to be the groin, so that would be like a groin injury that we talk about. But without getting too deep into too many different things, that's why we're going to focus on the back and the side. So what could it be? Because there's a lot of different things that it could be, and part of our job is figuring out what it is and then giving the proper course of treatment to work on that. A lot of things will overlap, and we got to work on some of the similar things, but to really guide our treatment plan, we have to try to figure out what it is with relative certainty. So the different things it could be are a glute strain. The muscle, especially the glute max, could be injured. That'd be more posterior, a little bit further back, and a little bit lower. So kind of under this hip bone over here. You also have another glute muscle called your glute med, which is more on the side. So we could have issues with the strain in that area. That'd be a little bit more on the side, a little bit higher up typically. You could also get what's called Trochanteric pain syndrome, or sometimes it's called hip bursitis, where on the side you get irritation of that tendon that attaches. So if you have that bone right on the side there, if you have pain right there, that's pretty indicative of Trochanteric pain syndrome. And that's more of the tendon of that glute medius muscle. So that's a little bit different also. We handle that a little bit differently. A little bit further back, SI joint, sometimes people can get irritation at that, whether it's not moving enough or it's moving too much. So that would be a little bit more further back towards the center. Piriformis Syndrome, that's a little bit more underneath, kind of like across the butt there. That's something to consider also. General achiness and loss of range of motion could be arthritis. So if you're getting older and you have a little bit of arthritis, or you have a demanding job or sport, then arthritis is definitely something that can affect your hip region. Labral tears are something else. Popping, catching, things like that. If you have those types of symptoms, those are some of the things we look for. And then high hamstring tendonitis. So if you're kind of feeling it, you think you're in your glute area, but it's further down, kind of right where on your sit bone. So if you're sitting and it hurts right at the very bottom, that can be a high hamstring tendonitis. So actually where the hamstring attaches underneath the glute. So it could be a little bit lower down than really necessarily the what's considered the hip region. And then there's other different bursitis that we can have, where the fluid-filled sac of the bursa gets a little inflamed. But another thing that I really want to key in on is that it might not be your hip at all. A lot of times people come in with hip pain and then it ends up being their low back. Their low back is actually what's causing it, because you have those nerves that come down and innervate those different areas in the hip and in the side and the lower back, kind of up in that hamstring. So sometimes people have, we find that they have low back issues. So that's one of the really important things of getting assessed by somebody, and not just doing all these different exercises you see online that are like for quote unquote hip pain, because it might not actually be hip pain. That's just where you feel it. You could have referred pain from the back, from the muscles in the back being sore, and then it just kind of refers down to that area, or it could be those nerves. So that's why it's really important to get assessed by somebody who knows what's going on, knows these diagnoses. So that's where we can come in. We offer free discovery visits so that we can sit down and see if that's something that we can help you with. And if it's something we think that we can't help you with, then we'll try to refer you to the right person. But that's why we do that for free. We just want to kind of make sure we're confident that we can help you before you give us any of your money. So that's that. If you want to take advantage of one of those free discovery visits, give us a call at 607-425-3369, or email us at Brett, BRETT, at limitlessptny.com, or visit our website, www.limitlessptny.com. Thanks.